Okay, hi, it's Dr. Buford. We're just getting started on the left shoulder here. We're looking in from the back to the front. Everything that you see is magnified about 30 or 40 times on the screen. We've got this blue cannula coming in the front, and then we've also got a switching stick coming in the front. We're going to be passing another cannula over that in just a minute. But before we do that, we're going to look at the biceps tendon here. The biceps looks good. We can tug on it, and we can watch as it exits the shoulder here. And that looks pretty good. We can come down and look at the biceps anchor. If somebody has an injury here, it's often called a slap lesion. You do not have that. That looks pretty good. We can look up at the rotator cuff, and this also looks pretty good. So next we'll look at the back of the shoulder. And we can see a little bit of a Hill-Sachs lesion here. We're going to look down the front of the shoulder, and here we see this Bankart injury. So I am going to do the remplissage even though you don't have a large Hill-Sachs, because I think that's going to give us a better repair, especially in a football player like you want to get back to being. And with the capsular laxity down back here, I think that's important. So we'll get to work here in just a minute. Okay, so here's this Hill-Sachs lesion in the back. We've just been working on it, trying to smooth it, or make it ready for an anchor, I should say. Prepare it. And now we'll take our Why Not RC guide and see where we can get an anchor. It looks like we're going to place an anchor in right about like that. Okay, one at a time. So here's the anchor in position. It's got 3 sutures. I don't think we'll have to use all 3, but we've got 3 to work with. The next step is to go ahead and start passing them one at a time. I'm going to start with the most inferior anchor, which is this, I think this blue and white one here. So we'll pass that. And we're going to take it out the front here. Hold the camera. Okay, so we've got all 4 sutures passed for the remplissage. We're not going to tie them yet, but it's going to bring up that capsule basically like that. We'll show you what that looks like in a little bit. Now we're going to work in the front of the shoulder. We need a rasp. And we're going to free up this labrum that's been detached. Pull back on the shoulder gently. So we're going to work right here. And then we'll show you some more in just a little bit. Okay, so we've got our first anchor in. You can see it right there. This is our suture hook. It's loaded with a black wire called the super shuttle. There it is coming out of the tip right there. We're going to pull it back. And now to do this first stitch, we're going to start here. We're going to rotate. Go into this inferior glenohumeral ligament and come out right there. And so we're going to go ahead and feed that relay through. We'll show you some more in a little bit. Okay, so we're just tying the 3rd knot from the 3rd anchor in the front of your shoulder here. And that looks pretty good. We're going to go ahead and cut the suture tails. And we're done with the Bankart part of this reconstruction. Okay. So this has all been repaired down the front. There's 3 anchors there. You can see how that's nice and snug. Happy with that. Now we're going to go ahead and tie the remplissage sutures in the back. Okay, so we finished with the remplissage. You can see how that capsule and posterior part of the cuff is right up against the bone there. Can't see the sutures anymore, so I'm really happy with that. We're going to finish up here and get you back to the recovery room shortly, okay? So good luck to you now. Bye-bye.